Namaskar, I am Dr. Rahul Magazine and I am making this video to tell a few things about when to manage a patient at home and when to manage a patient of when to send a patient of COVID to hospital. So we need to understand the treatment of COVID is basically based on the oxygen saturation. So long as the patient's oxygen saturation is above 94%, you can manage the patient safely at home, but under the supervision of a doctor. And more than one single reading of oxygen saturation, the trend in oxygen saturation is more important, because if we start checking the oxygen saturation of the patient from the day one of illness and start writing it down on paper, we'll get a clear indication that whether the oxygen saturation is stable or is it slipping. The moment oxygen saturation is less than 94, we need to be alert. Now I am not talking about some one-off reading of oxygen saturation. I am talking about a reading of pulse oximeter which is repeatedly coming, which is persistent. When you attach a pulse oximeter, initially it takes some time for the pulse oximeter to stabilize at a particular reading. So it may show a reading in the beginning, a lower reading or a higher reading, and finally it will, after 30 seconds, 1 minute, it will stabilize on one particular reading. That is the reading which you need to note down. The reading in the beginning may be very low, which is just the machine is just scanning, and only after it stabilizes you need to note down the reading. So if your reading is less than 94%, then the patient's relatives, the patient's caregivers need to be alert. And less than 94% saturation means the doctor will start prescribing you treatments like steroids and other things. And the patient party needs to be alert and start looking for a hospital. And the moment oxygen saturation becomes less than 90%, patient should be in hospital under any condition. So less than 90% cases should never be treated at home, and patients between 94 to 90%, the patient's relatives need to be alert so that they can look for hospitals as early as possible and shift the patient. So we should not delay and wait for oxygen saturation to drop less than 90% to shift the patient. We should be alert after 94% and start looking for a hospital and shift the patient. Thank you so much.